So basically, ataxia is a disorder and it affects your coordination and your balance and your fine motor skills. It was a known side effect. My surgeon told me this was going to happen purely because where we cut to remove my brain tumor in the cerebellum, this is responsible for those fine motor skills, balance, coordination area. And as soon as we cut in, immediately my symptoms came on thick and fast. So um, basically, it has severely changed my life. It's affected my walking, my balance, my coordination, my fine motor skills. I'll get more into specifics a little bit later. Um, but yeah, primarily it's all on my left hand side. It's kind of like I've had a stroke, and it's like my left hand side is shut down. Or as I say to people I've just met, and they ask me what's going on with you, I explain to them it's like the entire left hand side of my body is drunk, and my right hand side is completely normal, completely sober. I'm talking my fingers, my hands, my arms, my legs, my feet, my toes, even the left hand side of my face and the left hand side of my tongue has been affected. So the left hand side of my face is numb. I've got permanent tinnitus, so there's a permanent ringing in my ear, and yeah, the sensations in my face and even the taste buds of my tongue were affected by the ataxia. For any neurologists out there, correct me if I'm wrong, but yeah, once I got ataxia, it's basically like a line got drawn down the middle of my body, and the left hand side is drunk, and the right hand side is completely normal. So, things that I now find challenging that I have ataxia and my left hand side is challenged. Staircases is massive for those of you watching in Australia. You know we do everything on the left, so that means we walk up and down staircases on the left. And because my left hand is challenged and my walking is also challenged, it's hard for me to hold onto a handrail with my left hand and keep full balance. So it was really great when I did go to Europe a year and a bit ago. I went to France, and because they do everything on the right, I could grab the rails of all the stairs up and down on the right hand side, and I wouldn't ruin the etiquette of stay to your right, and I felt much more secure and stable on European staircases. So that was another perk of going to Europe. I also struggle with things where I use both hands for fine motor skills. So fine motor skills is where you use your fingers to grasp things. So things like buttoning a t-shirt, buttoning a shirt, tying shoelaces, putting on a tie, little things like that where I have to rely on both hands and fingers to basically connect and combine and collaborate to get a task done. I really struggle. So as you can imagine, trying to button a shirt in the morning to go to work and put on a tie and tie my shoelaces is a bit of a challenge. But not a pity party. It kind of is what it is. Other things that are challenging is typing. So I've got a keyboard right in front of me. I remember when I first started recovering from my brain surgery, I would literally sit at work and just type with my right hand because I found that easier. But then one of my friends, a wise person, she told me, use both your hands, otherwise your left hand will never improve. So I try and incorporate my left hand in all my typing now, even though it is a little bit slower. And I do hit incorrect keys. It's just a really good way to incorporate my left hand into my recovery. And another little side tip for anyone who's got left hand ataxia, put all your passwords for your work on the left hand side of your keyboard. So you have to use your left hand more. So letters like Q, W, E, A, S, D, Z, X, C. Make your passwords out of those letters, and even the letters 1, 2, 3, 4, 5, and 6. That'll force you to constantly use your left hand, which was a cool little tip that someone shared with me from a forum I was in. Another thing that's majorly been affected is my ability to prepare dinner. So as you can imagine, right? So when let's say I want to slice a carrot, I'm trying to hold a carrot with my left hand will shake. I'm coming in with my right hand with a really sharp knife, and my hand is shaking. As you can imagine, the increased risk of cutting myself skyrockets. So preparing dinner, buttering toast, all those little things where my left hand is very shaky and my right hand's quite normal. I use this pen for instance. Imagine I'm trying to butter bread and this hand's shaking everywhere. Yeah, I've had many days where I've had, Vegemite, butter, peanut butter, jam all over my hand. But again, this is just something that has massively improved. And if you don't use it, you'll lose it. So I force myself to cook, and I find cooking is a really good way to rehabilitate it and get my left hand less shaky and a little bit more accurate, which is great. Another thing as well that I challenge with, so I'll show you, I've got my drink bottle here, right hand, super stable, super normal. Left hand, I've got a bit of a tremor, and you can imagine if the lid wasn't on, all that water would go straight out. So I like to use the analogy when I tell people about my ataxia. Imagine we went to a bar and I walked up to a bar to grab 2 beers. I would have to bring them back one at a time. Otherwise, whoever's beer's in my left hand, they wouldn't have much beer left at the time I got back to the table. So these are other little things that I'm learning to cope with as I move through my recovery and my journey. So the ataxia itself, it makes me look like I walk with a bit of a limp. Because you can imagine, right, if your left leg is drunk and your right leg is fine, you will kind of look unbalanced and you look like a bit of a penguin. It's funny, I remember when I first got out of rehab and I started dating again, I put on my online dating bios, I've just had brain surgery and I look like a bit of a penguin, I walk with a limp, but I like to think of it as swagger. And yeah, that kind of made the dates I go on a bit more prepared with what to expect when I rock up, walking a little bit like a drunk giraffe. So yeah, I like to explain to people that ataxia and how it feels. Pretend you're about to put on a pair of jeans that are tight, but you put both your legs into one-legged jean. As you can imagine, there's not much room to wiggle, not much room to get your balance, not much room to get your gait or your walking stride into good equilibrium. And yeah, it's legitimately like putting 2 legs into one legs of a pair of jeans or really tight tights. Yeah, it can become such a tripped out thing trying to walk with ataxia, because it kind of feels like someone's using a PlayStation remote control and they're steering me around. Sometimes it feels quite challenging. Guys, excuse me again, going back to my notes, but I don't want to miss anything. So this point is, it has improved over time. I've come a long way. It's nearly coming up to 5 years now post-op. There were stages where I literally couldn't stand up on my own 2 feet. I couldn't walk without a cane. I couldn't walk unassisted. I couldn't carry 2 shopping bags. I couldn't type at all. I couldn't hold a piece of bread to butter it. I couldn't hold a carrot to cut it. But over time and just a repetition of forcing myself to not be lazy and to actually do things a bit slower and a bit more safely and force myself to use my left hand, I feel has really escalated and improved my results. It is slower and it is less efficient, but it means that my left hand is slowly catching up to my right hand. I don't know if I will ever recover, especially in the ataxia and the fine motor skills realm, but I'm going to give it a red good shot and try and improve moving forward. And another reason I've improved, so for those of you who don't know, I've got a small son. He's 17 months old. His name's Hilton. He is a very energetic little boy, and he will run and jump and drop things, and I've got to be behind him, and I've got to instinctively be agile enough to catch him or, cradle his fall or make sure he doesn't drop glass or a vase or etc. etc. So I feel my left hand is instinctively improved because, he's a lot of hard work. You can just ask my fiance, and my right hand's great with catching him, but my left hand is catching up slowly because it's naturally forced to. And it was funny, I was sitting at a cafe a few months back with him, and he knocked a fork off the table, and I actually instinctively just reached down and caught it with my left hand, And that was a really cool mini milestone that I took note of, because, months before that, if a fork dropped on the ground, my left hand coordination, even the ability to grasp and time it with catching a fork, would have been so diminished. And there's no way I would have caught that fork. So it sounds like something really little, but yeah, catching a fork with my challenged hand was a huge milestone for me, and something that I've taken a mental note of. So I guess some advice on how to recover if you do have ataxia, or how to most improve, if you do have ataxia. Don't not use your challenge side. Use it as often as you can. Like, I even give myself a monthly challenge where every time I go in a lift, or anytime I use a key to open a door, I have to use my left hand. Use your challenge side as much as possible. Yes, things are going to be slower, things are going to be less optimal, you might be in a rush, but just take your time. You're never going to create the pathways to connect your brain to your left hand side if you aren't repetitively using that side to do those normal everyday tasks that force you to use it. So yeah, another reason why I feel my ataxia and my coordination has improved is the physical therapy and the occupational therapy after my brain surgery when I was in rehab. It heavily focused on not only coordination and fine motor skills, but strength as well. So at that stage, I was really struggling to do bicep curls or shoulder presses, but my physical therapist really heavily encouraged me to use both. Otherwise, my left hand side would never have improved. So it's kind of a wrap up on ataxia. It's the coordination and imbalance issues, I guess you could say, where the left hand side of my body feels drunk and the right hand side of my body feels completely sober.